Okay, today with me, Muhammad Naim, we're going to talk about the panic disorders, and we got a few experts about this. And today, we're going to interview the first experts are going to talk about what is panic disorders and how do we diagnose it and why is it important for us to know. Let's go.
People with panic disorder experience unexpected and repeated panic attacks. This is the definition of the panic disorder. They become terrified that they may have more attacks and fear that something bad will happen because of their panic attacks, such as going crazy, losing control, or dying. Okay, most of the people will ask why it is an important issue. The international epidemiologic data reported that panic disorder lifetime prevalent between 1.6% and 2.2% in general population. Prevalent rates grow higher amongst certain patient population, such as those with cardiac case between 20 to 50% or gastrointestinal between 28 to 40% presentations. Okay, this is one of the most important part in this case. How to diagnose case of panic disorder. You may suffering from panic disorder if you experience frequent, unexpected panic attacks that aren't tied to a specific situation. Worry a lot about having another panic attack, feelings of being out of control during a panic attack, and are behaving differently because of their panic attacks, such as avoiding places where you have previously panicked. Actually, single panic attack may only last a few minutes, but it can leave a lasting imprint. Eventually, it will lead to two kinds of things, which are anticipatory anxiety and also phobic avoidance. Anticipatory anxiety is instead of feeling relaxed and like yourself in between panic attack, you feel anxious and tense. While the phobic avoidance, you begin to avoid certain situation or environment. This avoidance may be based on the belief that the situation you are avoiding caused a previous panic attack. Adults with panic disorder will often change their behavior to feel safer and try to prevent future panic attack. For example, they are like having a companion with family members or friends, accompany them places, or avoiding physical activity like exercising or having sex, or having another activity that might trigger panic-like feelings. That's all.
Okay, and the next expert are going to talk about what is the causes of this attack and how it does it similar to other condition. Okay, let's meet our next expert.
There are main four causes of panic disorder. One is family history. They are maybe running or not running in the family history. They are maybe combined with hereditary disorder like bipolar disorder or alcoholism. The second is abnormal changes in the brain. There are maybe imbalance between serotonin and dopamine or GABA. And there are anatomical changes in the amygdala area. And the third changes is in the substance abuse. There are like alcohol, marijuana, or stimulant drug like cocaine or amphetamine. And the last major causes of panic disorder are major life stress like death in the family members or being assaulted or sexual abuse. There are similar conditions that has the same symptomatology as panic disorder like cardiac condition. There are maybe cardiac arrhythmia or supraventricular tachycardia. And there might be endocrine disorder like hyperthyroidism, hyperparathyroidism, or pheochromocytoma. And there might be vestibular dysfunction. And there are three psychiatric disorder that has the same symptomatology like panic disorder. There are seizure disorder, anxiety disorder, or substance abuse like alcohol, cannabis, or amphetamine. That's all.
Okay, and the next, our experts are going to talk about the management of panic disorder. Let's go.
The management divided by two, investigation and treatment. The first, investigation.
Why we do investigation? Because we want to exclude medical condition. For example, blood sugar test, ECG and T3 and T4. Then for treatment, we have psychotherapy, such as reassurance, guidance to overcome the anxiety. We have also environmental management, and also we have drugs, for example, tricyclic antidepressant, TCA, selective serotonin reuptake inhibitors. We also have propranolol as beta blocker and also benzodiazepines. That's all.
Thank you for watching and staying with us. I hope you get what is panic disorder. I'm Naim. See you at the end round.